Ladies and gentlemen, welcome back to another YouTube video on the channel. Today we will be continuing our anatomy's journey and moving away from the spine, going forward towards the ribs and the sternum of the chest, and that is pretty much all that makes up the bony structure of your chest: sternum and the ribs. Now, for the ribs, I'll be explaining the different classifications, different types, and each characteristics of each type of ribs. And I will be explaining the sternum in all of its detail as well as all of its landmarks. It's a very short and easy topic. It's very nice, something that you can really read and actually enjoy. It is not that difficult at all, so I hope you guys enjoy it with me. Let's get into it. Now, as you can see in this image, this is the gross anatomy or the gross view of the thorax, of the bone anatomy of your chest, and it is composed of, and you can go ahead and count them if you don't believe me, 12 pairs of ribs, 12 thoracic vertebra and their intervertebral discs, and one sternum. Now, the whole thing makes up the chest cavity, and as you know, a cavity is anything that has a space, because you can see here there is actually a space in between the ribs. It is not filled up with anything yet. It is called the thoracic cavity, and the thoracic cavity has two specific landmarks: the thoracic apertures, the superior thoracic aperture, which would be around the region of the first rib, and the inferior thoracic aperture, which would go right around the inferior border of the chest. Now, the superior thoracic aperture is also known as the anatomical inlet, because everything enters through there when we're talking about the vessels, when we're talking about the spinal cord, the brains? Sorry. When we talk about the vessels, when we talk about the spinal cord, it is all entering through the anatomical inlet. Especially if you talk about the jugular vein and all, it is going downwards. Now, the anatomical inlet, or the superior thoracic aperture, has certain boundaries, and it is bounded by, posteriorly, it is bounded by T1, or the thoracic vertebra number 1, T1 vertebra, laterally by the first pair of ribs. Right here, as you can see, pair number 1 is binding this, and anteriorly by the superior border of the manubrium. This is the manubrium. Now, the inferior thoracic aperture, also known as the anatomical outlet, because when you think about it, the esophagus goes out of there, the aorta, the thoracic aorta, goes down and splits over there. Everything passes through there going downwards. The majority of things pass through there going downwards. And just a side note, the inferior thoracic aperture is actually blocked off and closed by the diaphragm, with only a few holes just for the vessels to pass through as necessary. So this region right here is usually blocked off. If you are healthy and you can breathe, it is blocked off. If you're dead, it probably won't be. Now, the borders for the inferior thoracic aperture include, posteriorly, we have the T12 vertebra. We need to start at the lowest point possible. We can't start at the point of T10. We start at T12 because that's the border. Posteriorly by T12, posterior laterally by 12th rib, or rib 11 and 12 if you want to consider them both, because this whole region pretty much, rib is 11 and 12 are posterior lateral. Anterior laterally by the joint costal cartilages of ribs 7 to 10, right, this, and anteriorly by the xiphosternal joint, which is the joint between the xiphoid process and the rest of the sternum, which is this right here. So this whole region like this is the inferior thoracic aperture, also known as the thoracic outlet or anatomical outlet. Now, this image over here is just like some sort of another view of your thorax if you are a breathing, living human being, where you can see that there's actually some mass in the middle. That's the heart. That's your heart that beats. So the rest is just the bones that you can see. If anybody wanted to see it in the x-ray view, I put it just there for fun. As we mentioned before, like in the vertebra, a lot of them had specific things that do not change. They are constant throughout all different types of ribs, no matter how you categorize them. And the same is here. There are a few things that are characteristic, or that are specific to the ribs, that are present in the majority of ribs. Now, the ribs are classified according to different categories. First of all, there are 3 different types of ribs, and these are the true ribs, the false ribs, and the floating ribs. True ribs are the vertebrosternal ribs, which are the ribs that directly attach to the sternum, and they are ribs 1 through 7, so 1 all the way to 7. The false ribs, or the vertebrochondral ribs, are ribs 8 to 10. These ribs indirectly attach to the to the sternum, and they attach through the costal cartilage, or they form the costal margin, and then they attach like we saw here. Ribs 8 to 10 all attached indirectly. See, rib 6 goes directly through its own costal cartilage, 5 through its own costal cartilage. Now, ribs, the floating ribs are the last category, which are ribs 11 and 12. These ribs do not attach to the sternum at all, no matter what. They have their own cartilage on the covering the tips of the rib, but that is it. It is not attached to the sternum at all. Now, going on to the second form of classification for the ribs, which are the typical ribs, which are ribs 3 all the way down to 9. The typical ribs have this exact same look. They have the precisely, there's not a single thing that is different about them through ribs 3 to 9. Now, let's break it down in the typical rib structure. Ribs 3 to 9 all have a head, neck, tubercle, and body. Now, the head has two facets, as you can clearly see here, the superior articular facet and the inferior articular facet, and they are separated by a very thin line, as you can see here, which is known as the crest of the head. So the head of the rib has superior and inferior articular facets separated by the crest of the head. Going downwards, we have the neck. Now, the neck is what connects the body at it's what connects the body and the head at the tubercular region. Now, the tubercular region itself has two parts. It has the articular part and the non-articular part. The articular part is a smooth region, and the non-articular part is generally a rough region. The articular part, or the smooth region, is used for the attachment to the transverse process of the vertebra, and the rough non-articular part is used for the attachment of a ligament known as the costotransverse ligament. We will get to that in a different lesson, but for now, we have the articular, non-articular part. The articular part articulates with bone, which is going to be the transverse process of the thoracic vertebra. Now, making our way downwards towards the angle. Angle is the region where the rib, let's say, bends or changes its direction significantly, because that is necessary in order to keep a sort of circular shape of the thorax. However, the body on itself is a thin and flat, yet curved along its length, and especially at the angle like we just mentioned. It also has something known as the costal groove, which protects the intercostal nerves and vessels. So the costal groove is a sort of line where the vessels and nerves can pass through as they enter and exit the thorax. That is, it is necessary for vessels to enter and exit throughout any cavity, and they enter and exit through their protection through the costal groove, so they are not damaged. And at the end here, at the end of the body, we have that side of articulation with the costal cartilage. Costal cartilage, obviously, for the sternum. So the head attaches to the vertebra. Keep in mind that the head is posterior. This is a posterior view of the rib. The head attaches with the thoracic vertebra, and going forward towards the body, where it attaches to the sternum. Now, going into the atypical ribs, which are ribs 1, 2, and 10 through 12, but starting off with rib number 1. The first rib, it is, as you can clearly tell, it is the shortest, it is the flattest, and it is the most sharply curved. Now, it acts as a roof for the thoracic cavity, and it has grooves along the side, as you can see here, these little indentations. They are grooves for the subclavian vessels, which are separated. This is group for subclavian, and this is a group for subclavian artery, and it's separated by the scalene tubercle. See this right here? Very simple. Now, another specific thing about the atypical rib, or rib number 1, is that it only articulates with the T1 vertebra. It does not articulate with two vertebrae, it articulates with only one, which is T1 vertebra, the top. So it only has one articulating surface on the head. It has a neck, and it has tubercle, as do the rest. So only one facet, because it only articulates with one vertebra, unlike the rest, which has superior and inferior, because they articulate with both vertebrae. Going downwards, moving on to the second rib, The second rib is very similar. It's a very strange rib. It's very similar to the rest of the ribs, to ribs 3 to 9, except that there is a certain little difference that there are formations on the rib for attachment of muscles. Now, I do not have an image for it, but there are formations which allow muscles to attach to it. It's a bit weird looking rib, yet it looks very normal to the rest. And 10th to 12 ribs are the ribs that only have one facet, and ribs 11 and 12, like we described previously, are floating. They do not attach to the sternum, and they do not have the costal cartilage at the same length as the rest of the ribs. And in addition to that, ribs 11 and 12 have no neck or tubercle, so they are clear of both a neck and a tubercle. Now, in general, we have one more last thing I forgot to mention. In general, we have 11 intercostal spaces, and each intercostal space has its own intercostal nerves and vessels that pass through it. And at the end, anything that passes beyond the 11th space, it is known as the subcostal nerve. The nerve that passes down beyond the 11th space is known as the subcostal nerve. Just a fun fact you guys should know. Now, final part of the thoracic cavity, which is the sternum. The sternum, my dear friends, is split into three major parts: the manubrium, the body, and the xiphoid process. Now, the manubrium, which is located at level of T3 and T4, has specific indentations as well. These indentations include the clavicular notch, the jugular notch. The clavicular notch and the jugular notch are both regions that are the jugular notch specifically is a region that is palpable if you put your hand right under your throat and you feel there's some sort of indentation, some sort of curve right there right at the tip of your chest uh, where your thoracic cavity would begin. That is the jugular notch that you're feeling. Now, we also have the clavicular notch, which is the region where the clavicle binds. That is not palpable, but you can palpate where the clavicle binds to the manubrium. It's a very prominent region there. And going downwards from that, now we finish with jugular and clavicular notch. Going downwards, we have the sternal angle. The sternal angle, it is the angle also known as the angle of Lewis, because I'm guessing the guy who invented it or discovered it is called Lewis. It is present at the intervertebral disc between T4 and T5. So right here, T4 and T5, this is the sternal angle. See, approximately at that level. Now, for the second part of the sternum, which is the body, which is present at levels T5 to T9, it is the longest and the widest region of the sternum. T5 to T9 has all of the surfaces for the articulation with all of the ribs, or most of the ribs, from ribs 2 all the way to rib number 7, which binds at the xiphosternal joint. That is rib number 7, because that is the final rib that binds. As we remember, 7 through 10 all merge their cartilages to form one cartilaginous process that binds at the xiphosternal joint. Now, there are transverse ridges, at the body of the sternum, and these are regions where the sternum was fusing together during development. Going downward to the xiphoid process, which is the final part of the sternum. The xiphoid process forms the xiphosternal joint, which is at level of T9 exactly, and the xiphoid process ends or elongates down to T10. So the sternum as a whole starts from T3, T4 all the way down to T10. It is approximately 6 vertebral levels in length, and you can pretty much palpate it on a thin person, and a very thin person would be even better, because you can palpate exactly all of the ribs and where they attach specifically the jugular notch. And that is, the jugular notch is actually used as a landmark to touch and to figure out where everything is when you are examining a patient. So that is pretty much it for today's topic. It's a very simple and short topic. I hope you guys enjoyed. I hope you guys were entertained and it wasn't too long or too boring for you guys. I love you guys, and I'll see you guys later.